Hello, my name is Sydney Rodman, and this is my podcast for Education 2120. Before I introduce my subject, I'm going to ask you a few questions to see and test yourself on your general knowledge of the topic that I'm about to address. My first question is, what is the only surgery routinely performed in the United States without the patient's consent, general anesthesia, or even a medical diagnosis? My next question is, what is a routine surgery performed on infants in the United States, but in most other industrialized countries, it's completely unheard of? My last question is, what causes at least 100 documented deaths per year, potentially many more, that can be completely avoided by use of proper hygiene? Now, the answer to all of the previous questions is circumcision. Before I get too in-depth, I'm going to tell you why this issue has caught my eye. When I was pregnant with my daughter, I didn't know any better. I thought circumcision was normal and the thing to do if you are a proper Christian. Luckily, I had a little girl instead of a boy, and circumcising a girl never crossed my mind. As she grew and got older, I toyed with the idea of getting her ears pierced. As I researched, I read other moms express their opinions on piercing infants. They expressed that if parents decided to take away the choice from their daughter, they should at least get it done by a trained professional. After looking into issues with piercing guns, I quickly agreed. A bonus of a professional was that many people reported less pain and a quicker healing time when done with needles instead of a gun. I decided to look for professionals to pierce her ears, only to find that in Georgia, they won't pierce an infant's earlobes until they turn 8 years old. I was slightly disappointed, but I decided that I would happily wait for her to turn 8. If she wanted them, then we could make it a really special treat for her. This sparked consent in my mind. The poor kids that had their ears pierced and had an accident, or the piercings were put in as an infant to change locations as they grew and changed. Did they give consent to have their bodies permanently altered? What about those that didn't have any issues? It wasn't necessary. Many people don't even like earrings. This whole mental dialogue got me thinking. We preach consent so hard to this generation. Shouldn't kids be able to have that right too? At the very least, when it's completely unnecessary and a very permanent procedure. After all, they're going to have to live with their bodies for the rest of their lives. After all of this played through my mind, I still researched. Many moms felt the same way that I did, but they took it a step further and mentioned circumcision. I tried reasoning that I would have it done for religious reasons, but it still didn't sit right with me. I decided to give my daughter a choice about her ears. How much more sensitive would a newborn's penis be? Fast forward 2.5 years. I'm pregnant again. I don't know if it's a boy or a girl, but I decide that his or her body is not mine to permanently alter. I tell my husband that I don't think we should circumcise this baby if he is a boy. He's surprised, but lets me make that decision. Our baby is born and he's a boy. I take one look at his sweet, precious face, and I know in my heart, perfection needs no alteration. He was born with a foreskin. He was meant to have that. The hospital staff asked me about my plans, and I said no to circumcision. This one word, this one answer, breaks the cycle on both sides of our families. All of this being said, I didn't start research outside of basic care until my family and friends started questioning my decision. Even then, I didn't truly dive into research until Jude was about to begin his daycare. As I was looking up some ideas on how to make sure that no caretakers tried to retract his foreskin, something caught my eyes on Etsy. It said, Watch elephant in the hospital. I did, and I cried. Another post said, watch American Circumcision, now streaming on Netflix. I did, and I was enraged. This started my spark. As I said earlier, I am a Christian. I thought that circumcision was something that good Christians do to their sons to mark them as belonging to God. However, no matter how I raise my children, I cannot guarantee that they will share my faith. Why should I put a permanent mark on somebody else based on my personal religion without their consent? I never realized or put together that as a Christian, I believe that Christ's blood paid for my sins. He was the final and perfect blood sacrifice. This did away with the sacrifices of the Old Testament, and apparently circumcision of an infant was a form of sacrifice in the Jewish customs. On top of this, Paul speaks out heavily against continuing this circumcision practice. He does it many times, but mostly in Galatians chapter 5, 1 through 6. He says, "It is for freedom that Christ has set us free. Stand firm then, and do not let yourselves be burdened again by a yoke of slavery. Mark my words, I, Paul, tell you that if you let yourselves be circumcised, Christ will be of no value to you at all. Again, I declare that every man who lets himself be circumcised, that he is obligated to obey the whole law. You who are trying to be justified by the law have been alienated from Christ. You have fallen away from grace. For through the Spirit we eagerly await by faith the righteousness for which we hope. For in Christ Jesus neither circumcision nor uncircumcision has any value. The only thing that counts is faith expressing itself through love." Now again, there are many other verses, but I'm not here to preach religion. All of my research also pointed out that this is a basic human rights violation in several ways. The first being autonomy. Every human should or has the right to decide what happens to his or her own body. This surgery is not only permanent, but it is damaging and can be deadly. A doctor has no way of knowing exactly how much skin to cut off of an infant's penis. There is no way for them to measure how big or small the infant's penis will be when he's grown up. Most intact men, when erect, utilize most, if not all, of this so-called extra skin. If that skin is removed before the penis is allowed to develop through puberty, there are many issues that this can cause. The next thing that I pointed out is that this practice is very sexist. Circumcision of males tells them that they cannot be taught how to clean their own body. It takes away the man's right to consent, while so many people preach consent to them about their daily interactions. It also harms their bodily image. It tells boys, teenagers, and men that they cannot love the body that they were born with. All of these things are the opposite of what parents are supposed to be teaching their kids. You have no right to decide what happens to your penis. You're too stupid to learn how to clean under your foreskin. Your natural and normal body is disgusting, and it needs surgery as soon as possible. People need to learn that our rights for our bodies end where another person's body begins. Now, the reason this topic is so debatable is that people say that there are pros and cons to both sides. The first pro that is commonly used is that circumcision lowers the chance of disease. The usual disease that they list is urinary tract infections, or UTIs. This is the only listed disease-avoiding benefit that would have a significant chance of happening before a child is of consenting age. There's a higher likelihood of circumcision complications than a boy getting a UTI. And when a little girl gets an infection, most people would tell her mom to get a prescription for antibiotics. not an appointment to have her foreskin removed. Boys should be able to receive the same treatment. The next argument is STDs, STIs, including HIV and AIDS. While there were studies performed in Africa that were used to prove that circumcision prevented HIV, these studies were later proven extremely biased in their research and findings. Several reconstructive studies have been performed that disprove these studies done in Africa. Nothing can prevent STDs and STIs except for safe sex practices. Both circumcised and intact males will have to practice safe sex in order to effectively avoid diseases or infection. So why exactly are we cutting off healthy tissue if it doesn't help? Another argument is penile cancer. Penile cancer is very rare, only occurring in less than 1 man of every 100,000 in North America and Europe. According to the American Cancer Society, circumcision has not been proven to prevent penile cancer. They recommend instead proper hygiene and avoiding known risk factors. Breast cancer in men is more common, about 1 in every 1,000. And yet doctors are not removing baby boys' breast buds as infants. Circumcision is cleaner and easier to care for. It's another constant argument. Well, in my opinion, if you don't wash something, it's going to get dirty. In infants and young children, you don't even have to retract the foreskin. If the penis is dirty, you just wipe it like a finger, from the base of it to the tip. At some point, boys will become retractable. This usually happens around the age of puberty, but it can happen earlier or later. Only the boy himself should ever retract the foreskin. Forced retractions by others is a leading cause of unnecessary circumcisions later in life. When a male discovers that he can retract with ease, he can be taught to pull the foreskin back and rinse himself with clean water, but this isn't truly necessary until puberty. Just like cleaning a girl's genitals, no soap or aggressive scrubbing should be involved. Circumcised penises look better or are the norm is an argument that's constantly used. It is estimated that only 30% of males in the world are circumcised. The United States circumcision rate has been declining for over a decade and is believed to be in the minority now. Personal preference in regards to genitals or even basic body looks cannot be helped. However, a parent's personal preference should not be forced onto their child. It's better to do it as an infant, so they won't remember it. I'd like to argue this with just because someone cannot remember something does not make it right or okay. On top of this, studies have shown that pain from circumcision permanently alters and affects the infant's brain. Now that we've discussed some of the pros and cons, I'd like to discuss some facts about keeping your foreskin where it belongs. Foreskin is natural and protective part of all mammals, male and female. I don't have time to go into all of the benefits of foreskin, but summarized, a male's foreskin does the following. It increases sexual pleasure for both the male and his female partners. It provides better lymph and blood flow. It maximizes the size of penis, keeps the penis moist, protects against some infections, and protects the penis from everyday wear and tear. The glands of the penis, like the vagina, is designed to be an internal organ, with the foreskin protecting it from getting calloused, dried out, and desensitized. Now, why exactly is this a diversity issue? Well, human bodies come in a huge variety of sizes, shapes, and colors. Our job, whether as parents, teachers, or just decent human beings, is to teach kids to love their body. We should not teach them that they aren't acceptable just because they look a certain way. That hinders diversity, and that is bullying. This one procedure tells boys that they are born less perfect than girls. They are less than them. It takes away their right for consent. Before they even have a voice, they are being silenced. Men are always told that consent is extremely important, and yet theirs is taken away. This is hypocrisy, and this is sexism. While I agree that parents need to be able to make medical decisions for their children while they're still young, this is a permanent decision, and it is more harmful than helpful. As an adult male, he can decide to be circumcised at any time, but he cannot regrow his foreskin effectively. Now, when newborns undergo this surgery, they're not put under general anesthesia because they're too fragile. Out of all doctors that perform circumcisions on babies, less than half report the use of anesthesia at all. In fact, only a fourth of obstetricians, who perform nearly 70% of circumcisions, use anesthesia. Newborns cannot be given any pain medicine afterwards either, again because they're too fragile. But even if this procedure were completely pain-free, do we have any right to do something that's not medically necessary? After the baby is prepped and restrained, one of the first steps is already involving ripping. Have you ever had your fingernail ripped off? Push back against your fingernail. The same type of adhesion that holds your fingernail onto your finger holds the foreskin to the meatus. The doctor must forcefully rip apart this adhesion. The subsequent steps can vary, but all involve clamps and cutting. This process removes the frenulum, which is often referred to as the male G-spot, and it is the most sensitive part of the male body. While some doctors use a local nerve block, and others offer a numbing cream to help manage pain, all babies can feel their frenulum get cut because of the amount of nerves that are located there. Some babies are in so much pain that they choke, code, or have seizures. Some are so shocked by the pain that they go into a coma-like state and remain that way for days. Their pain doesn't end there either. In order to make sure that this new wound heals properly, for the next year at each diaper change, parents or caretakers must retract any leftover skin and apply a barrier cream to prevent the skin from trying to readhere to the penis. Add this to the fact that a majority of this healing time takes place in a diaper full of urine and feces. Immediate complications of circumcisions can include, but are not limited to, cordy, hemorrhaging, penile amputation, necrosis, and death. Even if a circumcised baby does not have any complications, the adult male that was circumcised as an infant can have many complications later on in life. Some of the more severe complications include medial stenosis, adhesions, buried penis, and infection. Compare all of the above with an adult's circumcision. First, he's consenting to the surgery, which is his basic human right. Next, it is very rare that a man will ever have to go through this. There are creams, antibiotics, antifungals, medicines, and even a much less invasive surgery to correct nearly all problems associated with a foreskin or a penis. In the case of a consenting adult, the procedure is much more simple. There will be anesthesia and proper pain management for afterwards. The procedure is usually less complicated because he's probably already gone through puberty. The adhesions that kept the foreskin attached, are likely to have detached. It's also likely that since the man has gone through puberty, his penis is fully grown, meaning that the doctor will be much less likely to accidentally take too much off or mess it up. There's also a much larger chance of him being able to keep his frenulum. As an adult, he might have a longer recovery time than a baby, because babies do have stem cells. Again, though, the adult is the one that gets pain management and chooses to have it done. After he is fully healed, he will be less likely to suffer any permanent complications aside from some desensitization. which is likely due to the loss of all of the nerve endings in the foreskin. In conclusion, I hope that I have opened at least one set of eyes to this injustice done to America's baby boys. It is my hope that in a few years, we will be free of this social norm and that our children, male and female, will be able to keep their whole bodies as is their right. For future or further research, I recommend the resources that I have listed, or watching The Elephant in the Hospital or American Circumcision. A great place to start searching for resources is yourwholebaby.org. Thank you guys for listening, and remember, if a baby was meant to have his foreskin, he'd be born with it.